You may have seen the television ads asking if you, or if anyone you know, has the rare form of lung cancer called mesothelioma. If so, it says you might want to consider joining a class action lawsuit, a suit aimed at companies who used asbestos fibers in all kinds of construction materials. But there's a twist. The asbestos makers are fighting back with legislation that would limit the legal options for people who have the disease. Greater Boston's contributor Jennifer Jordan has our report.
It was not only lung cancer, but the rarest and deadliest form, mesothelioma, a malignancy that strikes the lining of the lungs. How bad is mesothelioma?
Bad as it gets.
As bad as it gets.
Survival rate, untreated, of course, is 0. And for the majority of patients, even with treatment, they're going to eventually succumb to their disease.
That's because the cancer cells extend over a broad area of the lungs and invariably return after surgery. Companies that manufactured products containing asbestos refused to pull them, even though they knew exposure to asbestos was hazardous.
Maybe I could speak to that. I think just to mention the importance of someone like Margie Levine. Sidney Farber, of course, who began treating childhood leukemias in the very early years, had a cure amongst the 99% of children who were dying. And he always referred to that patient. And they had a great correspondence back and forth and developed a real friendship. And it's the same sort of thing here. That is such an encouraging event to a medical team, to other patients. You really can't underestimate the power of Margie being here as a result of an initial therapy. It's so encouraging. And I'm very optimistic for Ms. Bright as well.
Margie's treatment involved about 5 to 6 weeks of daily radiation that was really aimed at providing local control, preventing the tumor from coming back. And what this means for Margie is that because her tumor involved the lung and the lung was not removed, we needed to give treatment to an area that included part of the heart, part of the normal lung. So we were faced with trying to give adequate dose to keep the tumor from recurring and at the same time not causing long-term toxicity to the normal structures that were still there, the heart and lungs, obviously.
If you would tell us about the relationship that you share with Margie.
From the beginning of my relationship with Margie, I always knew that she wanted to understand what was going on, and I tried to explain things as best I could and help her to understand what was going to happen or why we were doing things. And also, I knew that whenever she had a concern about a new ache or a pain, I always knew that it was important to pay attention to that. I do that for all my patients. And I knew that Margie also wanted that kind of listener, if you will. Oftentimes she would say to me, you know, people think I'm, you know, just crazy if I complain about this or that. And I never thought that that was true. And I don't think that way about any of my patients. But in particularly, I paid attention when she did have some new problem that was beyond my area of expertise. I made sure that I would refer her to someone who could help her. And just along the relationship that we've had throughout the years, we share a birthday that's almost the same, I think a day apart. And Margie always remembers my birthday with a very special homemade birthday card.
What does Margie offer to others?
I think Margie offers hope. And I think that that's one of the most important things that we can offer to our patients. No matter what the diagnosis or the prognosis is, I never want to take away hope from patients. And here for Margie, Margie's come through difficult treatment with a very, very grave prognosis, and she's a survivor. And so she provides that hope for all patients. And I think that's one of the most wonderful things that she offers.
I want to welcome you, Dr. David Sugarbaker, for coming on the show.
Thank you. It's a pleasure to be here.
You know, you have a busy schedule, and so thank you very much. Your position, tell us what it is at the Brigham and Women's.
I'm the chief of the Division of Thoracic Surgery at the Brigham and Women's Hospital.
All right. You have said of Margie, a woman of courage, a heroine, a pioneer, who's been instrumental in saving many lives. Do you want to comment on that? Say anything more about that?
Well, I think every researcher, every physician who's interested in treating a particular disease can look back to one patient who seemed to give them the encouragement to proceed with a certain treatment strategy that inevitably led others to have hope and to, in many situations, become well again. And Margie was that patient for me.